Welcome to the Retzel Health Law Hotspot. Health Law Hotspot is a podcast for physicians and health professionals that covers the legal issues and trends that affect the healthcare industry.
Hi, everyone. Welcome to the Health Law Hotspot. I'm Ericka Adler, shareholder and leader of the healthcare practice at Retzel and Andrus. Today, I'm joined by Debbie Rabishaw from Next Step Advisory. She's the founder and principal of that group and provides strategic HR support for small and mid-sized businesses. She brings years and years of experience and really focuses on compliance, operations, and talent management, including providing those services to healthcare providers and healthcare entities. So, welcome. Thanks for joining me.
Thank you so much for having me. I appreciate it.
My pleasure. So, today we're going to talk about something we really haven't talked about that much on this podcast, which is about the importance of building a strong foundation and having HR support within your practice. So, why don't we start with you telling us, why does it matter?
Why does it matter? Well, the you tend to your patients in healthcare practices, but sometimes the cobbler's children have no shoes, so to speak. And so you really need to be able to attend to your people and the health of your practice. And so there are several things that you can be doing, and probably it's already at top of mind. You just don't realize that there are solutions for them. And so a healthy practice matters because it reflects in the patient care that you provide.
So, what are some things that fall within the category of HR that so everybody understands what we're talking about when we talk about HR services?
Sure. So the first thing I would say is to build a strong foundation, you need to make sure your HR compliance is in place. It's kind of like when you have the foundation of a house, you want to make sure your house is built well before you start decorating it. And so many small businesses don't realize the risks of non-compliance when they're attending to their business. So that would include compliance in areas like payroll practices, record keeping, even how you classify your employees.
Okay, perfect. So really what we're saying is, your day-to-day employee management. And a lot of people are like, oh, we're small practices, we're fine. But that's where we
Hmm.
see a lot of issues coming up. You aren't paying overtime when you're supposed to. You're
Hmm.
calling somebody a contractor who's supposed to be an employee. And that's something you can get audited for. And we see that happen all the time. And I think a lot of times people assume, for example, if you're not full time, automatically you're a contractor. Well, that's not really the test for it. And so, I always urge my clients to talk with their, HR advisor or their accountant to kind of make sure they're doing that right, because a lot of people presume they know more than they do about these kinds of things. Um, so we've got payroll practices, record keeping,
Hmm.
classifying employees. I assume we also have, just day-to-day issues where people might claim that they feel they're being discriminated against, they feel they're being harassed, and there's a kind of a fine line between HR support and the law needing an employment lawyer, right? And I think that's really interesting because you don't always need to go to your lawyer right away. If you have good foundation and compliance policies in place, the answer should be there for you on how to proceed. Would you agree?
I would completely agree with that. I think you have to make sure that your house is in order, and a good HR professional can help make sure that you're doing that. When you talk about discrimination or claims that an employee might make, usually they make it because they don't understand what the rules of the game are, and we haven't done a good job setting that up for them, like in an employee handbook.
Right.
Being able to articulate what are the practices and the policies that you have to operate under when you're with our organization. And there are lots of unique challenges that medical practices have, like maintaining their employee certifications to make sure that they can deliver care, managing mandatory trainings, whether it's HIPAA or the sexual harassment prevention training, and then managing the mix of healthcare skills with good customer service. So there's lots of things that that need tending to.
Right. And I would add that, with healthcare practices too, some of the things that I see people forgetting are, some of the background checks that are appropriate in healthcare. So, for example, when you talk about their certification, one thing in addition to licensure and
Hmm.
certification is that they're supposed to be checking annually to make sure that person has not been excluded on the
Right, on the OIG list.
Right.
Yes.
So,
Right.
having somebody support you with a list of policies, procedures, and
Hmm.
checklists and annual training is so important. And I think a lot of practices are just so busy with all this administrative work and clinical
Hmm.
work that this sometimes is just somebody picks it up as a side job, and you can never do something the way it needs to be done if you're not paying proper attention to it. And I would guess that a lot of people think they really can't afford to go out and get an HR employee to come with them full time because that's something they can't afford. But they don't really realize there are services available, and if you can prepare upfront and where to look for the answers,
Hmm.
you can minimize your costs and your potential exposure. So it's like anything else, having manuals, as you mentioned, in place, having
Hmm.
policies, procedures, and doing things right from the start prevents, potential legal issues and costs down the road.
Right. For
Right.
example, the kind of support I provide is fractional support. So I can, come out and then kind of fade into the background once you address all the issues that you have. So it doesn't have to be a full-time endeavor, but it can be somebody who gives you some relief while you're really doing the work of caregiving and providing healthcare services to your patients.
And it's certainly less expensive than having to use your lawyer to resolve a problem once it's gone too far and you haven't handled it properly. So when we're talking about like a cost benefit analysis, there's no
Hmm.
doubt is, the smart way to reduce your costs, uh, both in terms of upfront preparation to comply and then minimizing the potential that somebody's filing an EEOC claim against you, the IRS is coming after you. Uh,
Hmm.
for taxes or whatever it is. So there's no doubt that this advanced planning is an absolute smart business decision. All right, so let's talk about some of the other HR type services. I know one of the things that you told me was talent acquisition and retention,
Hmm.
really key item that you work with healthcare practices on. So tell me a little bit about, you know, where that fits with medical practices and kind of the role that someone like you would play.
Sure. So, excuse me. Medical practices often struggle to attract and retain skilled professionals. Really important when you are looking for talent that you understand what you're looking for. So you might say, I need a front desk coordinator. And they need to do all of these kinds of activities, but you really need to understand what is the role you want that person to do, because it's very confusing if you think back to how you would like to be treated. It's very confusing to be asked to do 10 different things that are unrelated on top of whatever your responsibilities are. So, um, when you are looking to hire somebody and you want to retain them, make sure that you have effective job descriptions and that you have realistic benchmarks about your expectations of what that person's going to do. And then make sure that you have identified what your unique employee value proposition is. So, what sets your practice apart when you're trying to attract talent? And could it be that you have a family friendly work environment, or you have some kind of special, unique benefit that you offer? There's flexible scheduling. So you're trying to attract candidates to the environment that you're offering, but make sure you know what you want before you invite people into your organization. Otherwise, they're going to be unhappy, you're going to be unhappy, and that'll lead to turnover.
Perfect. I love that answer. And I think, practices, dental, medical, they really do struggle with, finding good hires and retaining.
Hmm.
So I think that's really important. And that really fits in also with having a handbook and clear expectations. And then
Hmm.
when I see people leaving, it's because they don't like how they were treated.
Hmm.
They found other people working in the practice to be abusive. Maybe they found the policies unfair, or they questioned if they were legal. So if you get all your ducks in a row, that's also
Hmm.
a way of being able to retain the talent that you are able to get in the door as well.
Right, and that leads to the next point that I would say, which is make sure you're creating a positive work culture. And there's a lot of ways that you can do that. If you have a toxic environment, it leads to burnout, to disengagement, to turnover. Healthcare is a high stress area, anyways. And so do what you can to encourage open communication and feedback and build a culture that supports work life balance, even in a demanding environment. It is not easy, but it can be done. And it really helps to retain the staff that you've put so much time into in terms of training and education and learning how to treat your clients within your environment.
Right. I would agree. I think a lot of practices kind of hire staff and just expect them to do their job, and there's not a lot of interaction or kind of wondering, are they happy? What do they do? What am I doing right? What am I doing wrong? I think getting that kind of feedback can only help you grow a stronger practice and
Mhm.
employees. I get the sense sometimes that people don't want to hear about it. If it's not related to the practice, they don't care. But that's a really, unfortunate attitude to have because, especially, with the generation of young workers today, happy
Mhm.
really big um, factor for them. They're not, I mean, they're interested in a paycheck, but there's really an attitude where I can go somewhere else if I'm not happy here, and
Yeah,
you're not making me happy, and I'm going to leave. And you lose talent that you put time and effort into if you're not listening to them.
it is a cultural phenomenon, how the different generations are interacting in the workplace. And so it is really important. There's often an attitude of if it's not broken, then I don't need to fix it. But
Like,
you don't want to wait till something's broken. You want to make sure that you're maintaining it, just like you would a car. You don't say, "My oil light's not on yet, so I'm not going to change my oil." You have a regular routine to make sure that your car stays healthy, and you have to do the same thing with your medical practice.
right. I think that's true. The communication, the way we communicate is so different now. People are on their phones, they're
Mhm.
using AI, they're texting. Obviously, there's a lot of training that's needed in terms of, compliance with HIPAA when we're in like a medical or dental type environment. But
Mhm.
so there's a lot of training needed, I think, in terms of expectations on behavior in the office as well. And I think that can all kind of be built in. So a lot of my practices really have challenges keeping people off their devices, stopping them, from posting things
Right.
that shouldn't be posted. So I think if you can connect with your staff, especially with the differences in generations, I am now old enough to be able to talk about side, I still think I'm like the youngest one in the room, but I think that's really important. And setting that out in the policies is important as well.
Yeah,
All
absolutely.
these interconnections between the different things we're talking about, you're attracting talent, you're making your policies clear, you're training, you're following up on their happiness and their understanding. It all is interconnected. These aren't like distinct areas
I,
necessarily.
I would agree. And a small team, in any size team, really, one disgruntled employee um, can can really create a ripple effect of negativity in the organization. And so you want to make sure you're addressing issues proactively, you're addressing employee relations proactively. Be willing to have those tough conversations and ensure fairness in how you are perceiving and addressing any disciplinary kinds of actions, but make sure you're focusing on their behavior and be consistent in how you give them feedback. And then make sure you document it because I'm sure you'd also say this if you don't document things, it didn't happen. So you have to make sure you're documenting the conversations that you have.
So, one of the biggest challenges I find with working with dental and medical practices, the consistent issues within the practice in terms of kind of bad behavior among staff. Um,
Mm-hmm.
it could be things like, mistreatment of other colleagues in the office. We definitely see issues of harassment, comments that rise to the level of discrimination.
Mm-hmm.
A lot of this is just young people who are not maybe aware or properly educated on the policies and the
Mm-hmm.
implications And so we see this coming up, and a lot of times practices will immediately call me and not know what to do. They want to fire the person, but they're a great employee and they don't want to lose them. uh,
Right.
Put themselves at risk when they take that attitude, because if the person that they mistreated was to go, and file a claim against them, you know, it's going to be a huge consequence. So, what are your thoughts, and how do you typically kind of guide practices on preparing and preventing kind of disruptive employee behavior, and being able to overcome those challenges and still retain that talent, especially when you put time and money into training? You could have somebody who's an excellent employee, but not a very excellent person, right? Um,
Hmm.
they don't treat people well, they're not nice, but they're an amazing worker, and that's a real dilemma.
Yeah. I like to look at performance holistically. So if somebody is intimidating somebody else, they're not the best worker. They're okay, but they haven't developed that side of them. And so I would suggest making sure that people are educated on what your expectations are, both from a performance, here are your responsibilities, but also what is expected of your demeanor and your behaviors in the office, and make that clear up front. And then have those tough conversations. Sometimes people don't know how to have tough conversations. They're conflict avoidant. And so um, there are ways to be able to have phrases in your toolbox and ways to start conversations that make it less confrontational. And so I would suggest that if you have those tough conversations, you're educating your team, you have the rules in place, then it makes it a much more reasonable conversation to have with somebody, and explaining up front, because we all want to know, again, the rules of the game before we play, that the expectation is that not only are you a good clinical performer, or you have good command of your responsibilities, but that this is an environment that also requires these kinds of soft skills.
Right, I agree. And someone like you really is helpful to a practice, because the person with the problem is not always the employees, but it can be the providers who own,
Oh, for sure.
and very often the manager of the practice,
Hmm.
whether, and sometimes in these smaller practices that's a family member. So if you're creating the environment by your own conduct, or your spouse's or family members' conduct, and it's very hard to objectively look at your own behavior. The
Hmm.
policies don't only apply to the people who work there, they apply to the owner and the managers of the practice. And I think, I hear lots of complaints about mistreatment, by the owners and managers of the practice. They put their own
Hmm.
business at risk. And so this is really important. And people need to hear this from someone like you, and not just apply it to everyone else, but to apply it to themselves as well. And so everybody needs to be trained. How you behave at home with your family is one thing, how you behave in your business is another, because you don't want to lose everything you built because, you know, you've got a harsh personality, you're insensitive to the comments you make. And God, I mean, we're a very oversensitive society right now. We're extremely woke. I hate to use that word, but almost everything you say is can be offensive, and there's a lot of backup, just about everything, as
Right, it's under
either
scrutiny. It's under
harassment.
scrutiny, and I couldn't say, more than you're exactly right. You have to be willing to look at your own behavior, and be willing to change. Nobody is without something that they can improve in how they interact in the workplace.
Right. I think that's really key. So, for people listening to this, you need this assistance to better run your practice and handle your employees. But it's also something that should be internalized as well for your own conduct, because your employees might be behaving, but are you behaving is the other question, right? So, that's
Right.
the harder thing as a lawyer for us to get involved with, when it's our own clients that have misbehaved and the claim brought against them by their employees. So, it goes kind of both ways. All right. So obviously, for a small practice, there's a lot to handle already. Somebody like you can come in and provide this HR support, get them up and running properly, or look at what they're doing wrong, get them set up. But
Hmm.
grow, these issues really become more complex. They've got more employees, more potential risk, maybe
Mhm.
locations that they can't be at all the time. This may, their office manager who's trying to run the practice and deal with these issues. It becomes more of a full time job. You know,
Mhm.
it gets more and more complex. What do you see going on in practices when that becomes the issue?
Well, I think what happens is things start to grow organically and not purposefully. And so you really need to consider what a strategic growth map might look for, just like your business. I'm sure many people have growth maps for their practice. They spend a lot of money on operations, on real estate, but how much are they spending on making sure that they retain their people, especially if they grow and they start to expand? And so I think aligning your HR strategy with your business goals just supports a sustainable growth model. And so if you plan ahead, it can make sure that you are growing accordingly. For example, um, I, often people will grow into the city of Chicago, starting in the suburbs. I'm in the Midwest. And there are different rules in that location than there are in the suburbs of Chicago. And so being able to know what you're going to anticipate as you expand into the areas that you want is really critical as well. And it helps you with your talent planning. How do you decide when you want to bring somebody in, at what point, and where they're going to work? And do you offer opportunities to move to the new practice and start it up, to expand somebody else's skills? So there's lots of things to think about when you're scaling and growing that can really be development and retention opportunities for your current staff.
Right. I think this is important. And one other thing I want to mention is that nobody starts a business without hoping or dreaming that it's going to be successful and going to grow. I mean, you
Right.
put everything into it. And for many of our dental and medical practices and other kinds of business, eventually they do find somebody who wants to buy their practice. And that's
Mhm.
true. This issue, these HR concerns that we're talking about, can actually make or break whether or not they can sell their practice. So when you have a buyer, what they're looking at is, are you being sued for the
Mhm.
employees were treated? Is there a risk for how you classified your employees? Do you
Mhm.
have high turnover? Are your employees happy? If we take over your practice, are they likely to stay? Right. So these are all, important for your day-to-day operations, but also important usually for your dream, right? Which
Right.
eventually to be able to either bring in new partners or to sell or whatever it is. And so these aren't just kind of very limited in scope to day to day, you know, um, concerns. This is actually part of a bigger picture for most people that are, either starting or operating a practice of some sort. So I can't tell you the number of transactions we do where the buyer's counsel is asking those very questions.
Mhm.
They aren't happy with what they hear. They want to see the policy manuals. They want to know, how you classified your employees, how you handle your time off. They want to know. And if it's not done right, you look like you have a sloppy operation. They
Right.
see potential risk that you didn't run your practice. What else is out there? If you didn't even know how to handle this, what else haven't you done right? Then they start questioning everything. So somebody, who can help kind of give structure to the HR process effectively is really going to be an important partner for a successful practice in a lot of different ways.
I would say it's not just a risk mitigation strategy,
Hmm.
but it is a business strategy to increase the value of your business and your medical practice.
Absolutely, I agree. All right, well, this is so helpful. And I know we could talk about a million different things that each HR brings to the table, but this is a really good start. So maybe what we'll do is a follow up podcast and kind of talk about some more specific HR challenges that we see going on. Is there anything you want to add as we wrap up?
No, I would just say that consider what your HR plan looks like for the year. What are your rough spots? And craft a go forward plan to address them. I think that would be how you can really address your employees' needs and preserve the business that you've created and put so much time into.
Perfect. All right. Well, thank you. This has been Debbie Rabishaw, and we're going to share her contact information when we post this. So if you have any questions, feel free to reach out to her directly. And certainly, I'll introduce any clients to you that I feel can use your services. I just see so many people struggling with this on their own, and I'm glad to know there's help out there without having to hire a full-time person. This has been the Health Law Hotspot. Thanks for joining me, and we'll see you again next time. Thanks so much. Bye bye.
The Retzel Health Law Hotspot is made available by the firm and its attorneys for educational purposes and to provide general information, not to provide specific legal advice. Use of the Retzel Health Law Hotspot does not create an attorney-client relationship between you and the firm or any of its attorneys. The Retzel Health Law Hotspot should not be used as a substitute for competent legal advice, and you should contact an attorney in your state about any legal needs or questions you may have.